Hello, my name is Erik DeAngelis, and I am a general surgery resident at the George Washington University in the Department of Surgery. Thank you for the opportunity to virtually present an e-poster for our project entitled Patient Risk Factors Associated with Increased Morbidity and Mortality Following Revisional Bariatric Surgery, an analysis of the ACS MBS AQIP database. I have nothing to disclose. The purpose of our study was to determine if preoperative patient variables are associated with an increased risk of 30-day morbidity and mortality following elective revisional laparoscopic bariatric surgery, and to generate expected model probabilities for 30-day morbidity and mortality outcomes in order to risk stratify individual patients. To do this, all patients undergoing elective revisional laparoscopic Roux-en-Y gastric bypass or sleeve gastrectomy from 2015 to 16 were identified within the database. We attempted to capture only those patients undergoing revisional bariatric surgery due to weight recidivism or inadequate weight loss by using a BMI threshold of greater than or equal to 35. We found that each of the preoperative variables were associated with one or more of the 30-day morbidity and mortality outcomes of interest. The strength of the predictive models, as reflected by the area under the curve, range from 0.63 for 30-day unplanned hospital readmission to 0.92 for cardiac events. A risk calculator for each of the 30-day outcomes is available online and can be accessed by following the provided hyperlink, which is also on our poster. For examples of the utility of our risk calculator, please refer to Table 1, which is broken down here. The first scenario shows the risk of each 30-day morbidity and mortality outcome for a 60-year-old African-American female with the given clinical presentation. The second shows the risk of each outcome for a 75-year-old Hispanic male with a distinct clinical presentation. You can see our calculator provides a probability of each outcome of interest, as well as a composite outcome for both Roux-en-Y gastric bypass and sleeve gastrectomy. In conclusion, we found that preoperative patient variables are associated with one or more 30-day morbidity and mortality outcomes following revisional bariatric surgery. By identifying these preoperative risk factors, we have created predictive models which can be used to estimate an individual patient's risk. We believe these models, which inform our risk calculator, can be used as a tool during preoperative counseling and optimization of patients prior to revisional bariatric surgery. Here you can see our poster in its entirety. Again, thank you to SAGES for the opportunity to present our poster.